the Health Minister, JoyNews, has been reacting to a number of these concerns this morning when he appeared on the Super Morning Show. He says 7 out of the 54 abandoned health facilities across the country will be ready for use this month. The facilities, which were constructed under the previous administration, include the University of Ghana Medical Center, UGMC, which government has committed to opening in 3 weeks.
There are about 54 uncompleted facilities across the country.
54?
Yes, not just the Ofanko type. No, but ones that have been actually contracts awarded by the ministry. About 10 polyclinics in Greater Accra, which haven't started. We are commissioning 6 polyclinics in the central region. Get information they completed maybe by end of this week. Early next week, we will go and do some final inspection and see if we can take over and start running them. There are district hospitals to 2 contractors, Eurojets and NMIS, that we are grappling with. One is in trouble a bit, and we are working through finance to see how best we can get it done. The indication we have seems to be like they have overdrawn more than works done, and money left from the records isn't something that we want to believe can complete the project. So the Minister of Finance had actually commissioned the value for money audit. When that is completed, we put a financier to work on that. The Kwai Hospital expansion is ongoing. Now we've sent a contractor there with also funding to support what he can do to do the expansion. Soon that project will also commence. We are sending, how do I call it? Cabinet has already approved for some facility to be taken. We're sending to Parliament for approval to look at Bolga to complete the whole thing. That's about $20 million to work on that. We are placing before Parliament again the phase 2 money for University of Ghana Medical Center, $50 million in a moment from tomorrow. I want to believe that we have to get that thing approved by Parliament by close of Friday latest.
But are we meeting the mid-July deadline for the UGMC?
Yes, we are on course. That is why I'm saying that, stressing that we should get that money by close of work this week. And then we'll get there. We have a committee which is on site. The contractor is back on site. We are bringing some of the Israeli professionals that were supposed originally to have come to join with us to see to operationalization. So we are on course. The committee is there. They had a meeting on Friday also again.
The Health Minister, JoyNews, there actually people have been dying to hear from him since over the week or 2 weeks ago. We've had a barrage, in fact, of health-related issues. Well, you've heard his responses there to why there are all these medical facilities there and people are dying from lack of beds or lack of access to health facilities. Before we hear from Vice President Dr. Mahmoud Bawumia, who says that tighter controls are needed to fix the wastage in the system, let's look at, again, at some of these facilities that we've just taken you through. And I have a list of them here just to give you an idea what we're talking about here. We're looking at the Ofanko Polyclinic, which has been completed but not operational because it's not been open. We're looking at the Anya Health Center that is also not operational at the moment. We're looking at the Accident Emergency Center at Amasaman, which also is not operational. Kaswa Polyclinic is there. We have staff houses at Sola Polyclinic, which is also not operational. And there is still some more that I'm going to take you through. Sections of the Damongo Hospital is part of what we're talking about. The health center at Gentilpe is also part of what we're talking about, and health center at Grupe is there. There's another health center at Nasoiri. There's another health center at Kabampe. There is one again at Laribanga, and the list goes on and on and on, and I could still show you more. But let's hear from the Vice President, Dr. Mahmoud Bawumia. As I indicated earlier, he says that tighter controls are needed to fix the wastage in the system after it was discovered that the country may actually be paying up to 6 times the actual cost of building district hospitals.
At a recent meeting of the economic management team, which the senior minister referenced just a few minutes ago, it emerged that Ghana constructs 60 to 80 bed district hospitals for $25 million. 60 to 80 bed district hospitals for $25 million. That day, even though I don't speak Fanti, I had to say Ebe. Today, you will hear the African Development Bank constructed a 150-bed hospital in Accra a few years ago for 5.76 million Ghana cedis, or the equivalent of about $1.3 million, which was without equipment. But you're talking about a 150-bed hospital constructed around $1.3 million. And even if we have to equip this for $1 or $2 million, the total cost would be some $3 million. So how come we are building 60 to 80-bed hospitals for $25 million? And this figure, the Minister of Finance will know, this $25 million figure does not include the tax exemptions that we are giving for bringing in equipment for these hospitals. That is an additional cost to the budget. It is therefore imperative that at the same time as we are seeking suitable investment opportunities to meet the infrastructure gap, the government takes steps to ensure cost-efficient program design and delivery to reduce financial wastage and protect the public purse. Ladies and gentlemen, it is in this respect that the government, under the leadership of His Excellency President Nana Addo Dankwa Akufo-Addo, has committed to seeking the investment required for the construction of roads, schools, and hospitals, and at the same time maximizing the efficiency of existing expenditure on these infrastructures to ensure value for money.
Vice President Dr. Mahmoud Bawumia, they're talking about wastages in the system and how we can cut those wastages, especially for us as taxpayers. I will tell you more about the health sector. But as I indicated earlier, the Minister for Health has been one of the most wanted men in the country. As I said, about the past month, we've been dealing with a lot of health issues, and he's been quite silent. Today, he's been on the Super Morning Show. So we've been asking you on social media what you think of his answers to some of the questions, begging answers over the month and over the past weeks. So let's move on and see what people are saying about his comments so far. Let me start with Thomas Aboyne. Says, what is this man's level of knowledge in health management? Can he really explain to us what a syndrome is? Okay, Deron says, out of 54 medical facilities handed over to you, you're yet to operationalize even one. And you are quite surprised with that exclamation there. Hope Kiani or Kiani, I'm not quite sure, but I hope I got it right, says no resource. They should use what? How do you produce without resources? So you mean, I think you're referring to the hospitals and saying that if they do not have the resources, how then do the hospitals function? Nunu Kwame Emmanuel says, you know this, yet you're prioritizing V8s over ambulances. Kiki Joe says, what a minister were these people. Okay, let me take this slowly. What a minister were these people that NPP was disturbing us with that they have the men. Okay, so you're basically saying that the NPP has been touting how much they have men to do the job when it comes to fixing this country, and you think that it's a waste. Benedict Ayayua says, well said, let's start treating you people on the floor first. Quite angry person there. Bagnidong Toko says, people like this should be sacked. You're not very impressed by the minister's responses. Brown Isaac says, populism at its apex. Damili Jamal Abdo is calling it hypocrisy, and Salimatu Ahmed Hussein says it's implementation, not tap. So it appears that most of you are not necessarily enthused by the minister's answers. You're not quite impressed as well. Well, at least he's spoken, and you know what he thinks, perhaps what he's doing about the situation, which needs dire attention. Well, the Ghana Health Service has assured that all abundant government health facilities across the country will be completed by this year. Director General Dr. Anthony Nsiasare made this known whilst touring an uncompleted facility in Bekwai, from where Kwesi Deborah is supposed to join me. Hopefully I have him on the line now. Kwesi, can you hear me? We don't have Kwesi Deborah at the moment, but he's been following the director of the health service there. We'll get those stories for you in a bit. But let's